Um, our topic for this evening, as you can see, is habit reversal training for skin picking. After a string of more, let's say, theoretical topics, you've selected one that's highly practical. So I will guide you through the process of habit reversal training. And hopefully by the end of the webinar, you will have a good idea about how to do it yourself and what's the point of it and how to proceed in case you really just want to try on your own without finding a therapist. I will also give you a number of free resources that you can use to successfully complete habit reversal. So these are some of the topics that we will be talking about. As always, we'll just define what HRT is. We'll talk about why this is a good solution for skin picking, what are its strengths and limitations, because every method has those inevitably. And then I will present habit reversal to you in 3 different stages. We'll talk about awareness training, about implementing competing responses, and then about evaluation and further work. You will see what further work means, and then we will proceed to the Q&A part. There are other ways to divide habit reversal in more stages, but I think this is the simplest way for most people to implement it on their own. And you will see that further work covers, I think, these issues well. And if you've been attending other webinars that we've had, then you more or less know what this further work refers to. So what is habit reversal training? It is a very simple behavioral treatment that's designed to address different types of repetitive behaviors. So here we will be discussing specifically how to use habit reversal training for excoriation disorder or for skin picking. However, that's not the only place where you can apply it. It's widely used to treat tics, even Tourette syndrome. It's used for hair pulling. It's used for nail biting, stuttering, lip biting, you name it, any type of repetitive behaviors. I've seen therapists who have even tried to use it for obsessive compulsive disorder. If you ask me, I don't think it's quite appropriate because there are far more efficient methods of treating OCD than just habit reversal. And I think, in general, my opinion about habit reversal, if I have to define it right now, is that it's a very useful intervention to manage the symptoms, but I don't think it addresses any of the causes. So it will reduce your symptoms, but once you complete habit reversal, there will still be issues that you could be working on to actually, make the urges go away, or at least redefine your relationship to them. The reason why we're talking about habit reversal is, well, one, you asked for the topic and that's what you selected, and second of all, because it is a type of treatment for skin picking that has been shown to be effective. In fact, it has been widely tested for all these different conditions that I have just listed, and there is quite a large effect size across different disorders. That means that not only does it work, but that it seems to reduce symptoms by quite a lot. So it's also a very efficient form of treatment. Very rarely will you see that therapists only use habit reversal treatment. We usually combine it with other types of interventions. One of them is decoupling. Decoupling is, I wouldn't even go so far as to call it a proper intervention. It's just an approach that it's basically a self-help intervention where when your hand starts going up to pick, you perform the opposite movement, which is supposed to lead you to become irritated enough to not want to pick at all. If you ask me, it's maybe something that can amplify certain aspects of habit reversal, but I would really not be that generous to call that a form of treatment. Another form of treatment that's often combined with habit reversal is acceptance and commitment therapy. And in fact, our program SkinPick is actually a merger of these two, plus another technique called stimulus control. I will not be talking about acceptance and commitment therapy tonight, nor stimulus control, because that would be, I think, just too much material for one webinar. But the topic is in the list, so if you want to learn more, you can vote on this. You can also visit some of our previous webinars, because we've had a webinar a while ago now about experiential avoidance, or I think it was titled Emotional Avoidance and Skin Picking. That one talks about certain ideas from acceptance and commitment therapy that you might find useful. So overall, that's what habit reversal training is. It's a behavioral treatment for repetitive behaviors, the simplest way to define it. Now, a lot of authors say that it actually contains 5 components, although if you look at different ways of implementing it, you will find different ways of dividing these components. I've divided it into 3 stages because my goal here is to help you apply it on your own. And I think the simpler, the better is when it comes to these things. So but properly speaking, the 5 components would be the following: awareness training, competing response training, contingency management, relaxation training, and generalization training. When I divide it into 3 stages, my 3 stages are the following: awareness training, which is the first component here. Then competing response and contingency management would be the second stage. And then generalization training and a kind of evaluation would be the third stage. Relaxation training is something that I think should be done parallel to this, but learning relaxation techniques is a separate matter altogether, something that we can have a whole webinar on if that's what you would like to learn about. And I will explain where and how you can implement this in my 3-stage model. And another reason why I'm presenting it in 3 stages is because it helps you integrate it much better with acceptance and commitment therapy, which is what we do in our program. So people who are already in the program but would like to put their treatment into a kind of context will find their way, I think, better if they go like this. So without going on my endless tangents, let's start with stage 1, which is awareness training. This is the most important stage of habit reversal, without a doubt. And it's also a stage that most people want to skip or eliminate or somehow shorten or accelerate. In this, which is just, if my tone didn't indicate, not a good idea. So in this stage, we're actually learning how to bring special attention to skin picking. And this is done for the purpose of understanding the details of its functioning. So think about it like this. First, in order to apply any technique to stop skin picking, you have to be aware that you're about to pick your skin or that you are picking your skin. That means that you need to have awareness. Awareness is trained in many different ways. So this is why I say that it's the most important stage, because it's the most fundamental one. Everything else, you can choose the best technique in the world. Unless you actually know that you need to apply it, then it's kind of meaningless. Awareness training, however, doesn't stop there. It's not just about noticing that you're about to pick or that you are picking. It's also about understanding emotions and thoughts that precede picking, those that occur during picking, and then after. It might seem in the beginning that you don't have any thoughts or feelings during, before or after, because I've seen all cases. This is, however, not true. As long as you're alive, you have thoughts and certain things happen in your body. It's just that it's usually very difficult to put them into words, which buttresses my point about how important awareness training is. When you start doing awareness training, you start writing down or noticing whatever you can. Perhaps it's very hard to define an emotion. Maybe you can't say, I'm angry, but maybe you can notice that your heart rate is accelerated. So just know that. That's not obviously an emotion, but it is a component of one. Let's say you might notice that there's a tightening in your chest, or just today when I was responding to clients, one of them said that they couldn't identify an emotion, but they did notice that they have like a lump in their throat that becomes condensed just before they're about to pick. So that would be one thing to notice. So you don't have to try and find precise definitions for what you feel, especially if you're working with a therapist. A definition, or let's say a proper label for an emotion, is very useful if you want to convey your experience to someone else. But for you to actually understand the mechanics, you can invent your own words. And your therapist will learn your own language. So it doesn't matter how you name these things, as long as you find a way to name them. One special thing so there are two things that I would emphasize here. One is awareness training needs to focus, and this is very important, on emotions and thoughts just before you pick. So those are extremely important because they either represent triggers or our interpretation or reaction to triggers. In either way, in either sort of these possibilities, this is extremely important because it helps us understand why is it that the urge arises in the first place. During whatever you can notice is good. And then after, there's one specific component that I usually direct people towards noticing, which is if there's any kind of relief, tension release, gratification, pleasure, any of these things. Shame and guilt are quite common, and this is very easy to notice. So most people are aware of this even before they start, because I think of almost of all the mental health problems that I work with, BFRBs tend to carry around so much shame that this is something that people are very well aware of before they even start treatment. But pay attention to the pleasure or release or gratification. And make sure to really sort of feel that feeling. Notice where it is in your body, what thoughts are associated with it. Try to recall the feeling later on, and then just let your mind free associate, see what else is similar. I know that this might sound counterintuitive, but when we talk about excoriation disorder, we're not talking about just this ordinary meaningless habit. Actually, there is no such thing as a meaningless habit. For something to become a habit, it has to be repeated over and over and over and over again. And that means that, that it does something, that it serves a purpose, that it's maintained for a reason. And if you remember the webinar that I referred to previously on avoidance and experiential avoidance, one of the functions that skin picking performs is that it provides a kind of soothing response. So there's often this gratification. It is very important that you understand what this gratification is like, because then you will be able to find similar resources to obtain similar or the same kind of gratification. Another thing that we study in the awareness training stage is how to understand the mechanics of the movements. So what comes first? The urge or seeing or feeling something that you want to pick? When the urge arises, what is the next thing that happens? Do you walk into a room to hide, or do you approach a mirror, for example? Or do you just simply start picking without any instruments, or do you pick up an instrument? How does your hand go from wherever it was to the part of your skin that it is about to pick on? So this entire arc of your hand movement is incredibly important that you mark. So awareness really means this. It's very detailed and very pedantic. And then, of course, awareness training serves to identify triggers. Triggers are extremely important because this is where the meaning is contained. It's like what the trigger means is why we have to pick in the first place. And we also had, I think earlier this year in January, February, we had a long webinar on why triggers trigger us. So you can go and check that out as well. But identifying triggers is quite important. And roughly, and for the purposes of our work here, it's important that we understand that triggers can be both external, but they can also be internal. You can be triggered by your boss, by someone's words, by a sound, or whatever else external, but you can also be triggered by a thought. You can be triggered by a feeling. So this distinction is also important to make. And then, of course, it's important to identify the context in which picking takes place. So do you pick at work? Do you pick while you watch TV? Do you pick before bed? Is there a specific time of day when you're more likely to pick? All these things are very important to note because they will help you select a technique to combat picking. So when we in the second stage, when we implement competing responses, all these will help you identify appropriate competing responses. And then there will be some situations, and I will tell you when I sort of underline what the limitations are, where you might have to step outside of habit reversal and implement something else where these techniques might not work. One of the situations is if you pick when you're extremely tired. Sometimes it can be really very difficult and challenging to go and use a competing response. So in that case, perhaps reaching for something outside of habit reversal might be a better way to go. But I will emphasize these points. And then if you're interested, we can have I can either talk about it more this evening, or we can have whole webinars to sort of make up for what habit reversal doesn't cover. In our program in SkinPick, habit awareness training, usually takes about 2 weeks. Now, this might sound like a lot, but in most cases, if you ask me, it's not enough. So when you start implementing awareness training, please take your time. Whether you're in the program or you're doing it on your own, take your time with awareness training. The more you do it, the more aware you will become, and the more aware you are, the more efficient the latter parts of the process will be. Sometimes awareness training is extremely stubborn. Identifying our emotions can be very difficult. Sometimes when picking is mindless, it is very difficult to identify what triggers it because you just catch yourself doing it at a certain point. When you do awareness training, then you need time so that you can pick up on all these cues. My recommendation is to do it at least for 2 weeks. And if you have to divide it, I would suggest that the first week you try to monitor everything. I will explain how you can do it in the next slide or the slide after that one, but just briefly now. So in the first week, gather as much information as you possibly can. So write down everything, no matter how irrelevant or banal it may seem, just write it down. That's everything you can possibly relate to skin picking. And then take some time at the end of the week and evaluate what you have. And then identify where you have enough data, and then identify what your weak spots are. And then the second week, just do those parts where your awareness is lacking. So for example, if you exhibit both types of picking, focused and automatic, so mindless and conscious, like 2 basic types, then in the first week, make sure to record as much information as you possibly can about both of these types. And then second week, focus only on the automatic, because the awareness is there for the focused picking. And we're after awareness for the automatic picking. So that's then what we're chasing after. So if you need even more awareness training after those 2 weeks, narrow it down even more. The reason why I'm suggesting this is because awareness training can be quite overwhelming in terms of how much information you need to gather. And the idea is not to frustrate you even more, as if struggling with picking is not hard enough. So the idea is to do it in a strategic way. So first start with everything and then slowly narrow it down to those areas that are particularly troublesome for you. Now, many of our clients, and specifically not just in the program, but my own clients in my own practice, have this tendency that they want to skip this stage. It doesn't seem usually active enough to them, or because you're just gathering information, you're not doing anything to actively combat skin picking, or because they seem to think they're self-aware or introspective enough. I have to say, if you are struggling with it, then you're not. It's just as simple as that. So awareness training has 2 main goals. One, to make you aware. If any of your picking is automatic, if you're not able to identify all the components that I've just listed, then you're not aware enough. Because people usually think if they like to think about themselves, if they like, to think about personal development, if they like to think about what they feel or think about certain issues, they think this gives them psychological introspection, but it doesn't. And also, when it comes to habit reversal, this is a behavioral technique. So we're not quite interested in, whether or not you had a cold and distant mother. This might be important for some other type of treatments, and this might be important in the long run. But when it comes to awareness training, a general kind of introspection is worthless. What we need is fresh and active data. Our memory is very deceptive. If you go by choosing your techniques from memory, you're very likely to miss out on something. So we need fresh data. It's not that you're not smart enough or that the way you think about yourself is not good enough. It's just that we need very specific data here. So without exception, it is always wrong to shorten or eliminate awareness training. And I can guarantee you that without proper awareness training, nothing else will work. I've had this conversation. I'm sorry if I sound, like a mean mommy now. It's really not my goal, but I've had this conversation, I think, thousands of times over the years. And eventually, when clients are persistent enough, because it's not my treatment, it's theirs, I will say, fine, don't self-monitor, skip awareness training. And then inevitably what happens is they say, well, competing responses don't work. No, the competing responses actually do work, but habit reversal is a structured training. So you have to kind of follow the protocol. And this is the protocol. Before stage 2, you have to do stage 1. So even if it may seem like it's boring or not stimulating enough, this is the foundation, and it is absolutely the most important part of the treatment. So just please keep that in mind, write that on your wall, tattoo it on your forehead, put it on a post-it, whatever, just do not skip this part. It is very important. So how do you do this, and what information do you collect? Now, the easiest way without much fuss is to just download our app. Type in SkinPick in your app store, and you will find our app that has predefined questions already. So all the information that you need to record, the app will ask you for. The app can also generate a PDF, and then you can print it and look for patterns and analyze the data yourself. So that's very easy. If you already have a therapist that you're working with and you want to implement habit reversal training, you can, first tell your therapist to listen to this webinar, and then you can share your reports with them. We do not keep your data. We do not store your data on our software. Everything stays on your phone. So installing the app is not divulging anything personal. So it's all yours. That is the simplest way. Another way that you can do it is to create a journal that will be dedicated to awareness training specifically. If you do this, I would suggest that you either have 2 journals or that you have a very small journal. Because one of the things about awareness training is that it exists in the moment. Awareness is not something that is kind of vague and permanent in time. So what you feel before you pick is something that you will likely remember accurately for 30 seconds, and then you'll forget. So self-monitoring has to be done in the moment. So one of the reasons why personally I like journaling is because it invests people more. You can also journal about other topics. So for example, if you're a type of person that has their phone on all the time, you can use the app to quickly record the data. And then at the end of every day or a couple of times a week, you can use that data and then structure it in the journal. And when you do so, just write a brief overview of what your day was like, about what was stressful during that day, about how you felt, and also add a little bit about what you did well. The reason why I'm saying this is because when we only focus on the bad, awareness training tends to be really grueling and irritating, because all you do is essentially focus on what you're not doing well, right? So write a little bit about those situations where you felt the urge to pick, but you resisted. Write about something that you're grateful for. Write about your strengths. Write about certain good qualities that you have that might help you later on. So this is why I prefer journaling, because it allows for more balance in how you look at yourself, whereas the app is strictly focused on skin picking. The more you customize your journal, just, like stickers, collages, all of these things, the better. So just knock yourself out. This kind of personalization will get you more invested into the process. And also, there are people who don't express their emotions very easily with words, but for example, can do that with images. One of the reasons why I always use art, although today's webinar will be rather artless, I have to say, but why I usually use art as examples is because a lot of people like it, because when they see an image or understand a work of art, it resonates with them and causes them to feel a certain way. Music might do that for someone else. So if you have a hard time with emotional recognition, think of a soundtrack for that situation, or think of an image. So later on, you can print or paste that image into your journal. You can do a digital journal, you can do a printed one. I'm a person that really likes journaling, and I have like 4 different journals. I have like a dream journal, my everyday journal. Like I do all kinds of journaling because I think it's a very good way to collect information about ourselves. Just remember that if you decide on journaling, then write a short recap of your day in 2 or 3 sentences. Write down what your triggers were and where you were when you picked, how you felt and what you thought about, and then add a little bit about what you did well, whether you resisted picking is in a certain moment or you just did something nice throughout the day, because the idea is to kind of balance out the way you see yourself. We don't want a journal that is only going to show the worst of you. But on the other hand, we also don't want a journal that is going to say how absolutely awesome and perfect you are. The point is to integrate both into one. That way we get to learn about picking, but then we also get to learn about your strengths and your capacities to fight picking. Because despite popular belief, it's not that we react to every urge to pick. Very often, and you will notice this during your awareness training, in front of other people, you will show remarkable strength and not pick. And also sometimes people don't feel the urge to pick around other people, which can be an important piece of the puzzle as well. So journaling is a very good way. Self-monitoring with the app is, I think, the fastest and most efficient way. It depends on how much time you have to invest in the whole process. It's not sufficient to be mindful of the behaviors. So awareness training is not just about noticing what's happening. This is obviously necessary, but it is really important that you write these things down, and as much as you can, and in the moment if possible. I understand that it's not always possible to write everything down, especially if your picking is mindless and then you catch yourself picking 20 times a day. I think everyone would be frustrated. But then try to do it every couple of hours and just write a little bit of a resume of what's happened, or do it as much as you can for a few days and then print out, or if you're using the app, print out your log or go through your journal and see what the most common situations are, and where, because there will be situations where perhaps your emotional response will be very clear to you, so you can put these away and then you can focus on what's troubling. So it's perfectly okay to slowly over time just streamline your self-monitoring and your awareness training. We want it to be efficient. That's the whole point. Also, when you write down how you feel, please avoid writing general, vague, and uninformative things. Uncomfortable is not an acceptable answer. I mean, you can write down in your own journals whatever you like, but if you sign up for the program and you have the misfortune of me being assigned to be your therapist, and you tell me you feel uncomfortable, you can expect me to ask about 50 questions, because that means nothing. Uncomfortable just literally means something vaguely not good. This is not what we're after. We need more precise information than that. If you say stress, that's also too vague. Stress can be because you're extremely happy and then you can't contain how excited your body is. Stress can also be because a family member died of COVID or because your job is on the line, right? Stress can be because you had a fight with your husband, for example, in which case maybe the emotion is actually anger. So it's okay to start with these general terms, but then try to put them in the context of the situation and come up with a more precise formulation. This might take time. So if all you can start with is stress or anxiety, fine. But then over time, try to add more details and add more layers, because the more precise we are, and the more awareness we have, the better we will do in the later stages of the program. If you like, in order to boost your awareness training, you can introduce something like regular mindfulness practice. Both formal and informal mindfulness will do. If you've ever listened to me, you know that I heavily favor formal mindfulness first. So, for example, body scans can be quite useful because a body scan during awareness training will help you become more aware of body sensations. And this is usually how we can easily identify our emotions. So practicing body scans every morning, for example, will help you be more aware of your body throughout the day. I see that literally 10 of you just raised your hands. So just please type your questions if you have any about this, and I will answer all of them. Right. So to summarize, the goal is to gather empirical data so that you can choose appropriate techniques. This is what we're doing. We can boost it with mindfulness practice. Journaling and self-monitoring with the app are two best ways to go about collecting information. Also, to recap, at least 2 weeks of this is what I would recommend. Just obviously one more thing. If you come to a certain point and realize that your competing responses work in only a certain set of situations, you can go back to awareness training in, let's say, one specific setting, of course. But it is important that you always follow this set of steps. So you've done a couple of weeks of awareness training. You know exactly what your thoughts, feelings are before, during, and after. You know what comes first, the urge or seeing something to pick. You know what your triggers are. You're able to describe the whole process in detail. That means the time has come to start implementing competing responses. So you're ready for stage 2 at this point. A competing response is just a physical action that's meant to, I was very illiterate when I wrote this. In my own defense, one of my New Year's resolutions was never to use spell check until December, because I've noticed how I've become lazy, and well, that hasn't changed. So a competing response is an action meant to compete with and replace picking. Now, think about it like this. Picking is obviously not just a habit, as I said, but it does have a habitual component. So it will occur with certain regularity in specific contexts. So every habit exists in a specific context. They're not generalized to everything. We also have one webinar, I think, on changing habits and understanding habits. So you can learn more if you go to our YouTube channel. We can also repeat the webinar and add more stuff to that as well. I think it might actually be quite useful. But my point with this is that a competing response also has to become habitual. So it's not sufficient that you select let's say, a competing response that works. It's important that it's something that you continue to use all the time, even when you don't have to pick, so that you can establish that as a habit on its own. Usually a competing response is recommended to be in some way an opposite action of the action of skin picking. But I suggest that you don't really focus on this too much. For some people, this works. For others, it doesn't. For example, the idea is that if your hand goes up when you're supposed to pick, then the competing response should involve your hand going down. this is really fine for some people and works very well, but it doesn't work well for everyone. For some people, using the movement and then redirecting it in the last moment is what works better. For other people, ignoring this movement thing altogether works well. So I'm putting this instruction here because this is something that you will find in manuals and in our program as well. But in my opinion, you can ignore it. The only important thing is that it works, and that's about as much as it's relevant, right? So choose what works. Don't get bogged down by the rule above, as I said. The important thing is that they're easy to use and that they're discreet, especially if you sometimes tend to pick around other people or when other people are present in specific spaces. It is important that you can apply a competing response without everyone noticing. And the reason for this is because there's already a lot of shame attached to skin picking. And then if you have a very robust and complex set of actions that you have to take, it will be obvious, raise questions, and then increase your shame, increase your frustration, and then produce even more urges. Not everyone cares that their competing response is discrete, but a lot of people do. And I think, in my opinion, I think this part that they're easy to apply, simple and invisible, is just practical. But again, whatever works with you, for you is fine. Start with one competing response, not 21. And I'm saying this with all my love and with over a decade of clinical experience. No human being has established 8 habits at the same time. This simply has not happened. And what people usually do in our program, and this is not just my experience, so this is an experience of every therapist that I know that works with body-focused repetitive behaviors, is that people, especially if they get a list of competing responses, they will select 6, for example. And then they will say, starting from tomorrow, I will do 6 competing responses, and then they throw in decoupling and a little bit of stimulus control and this and that. And all of it just ends up being a complete mess, and then they fail. So my suggestion is to start with 1, perhaps 2, but not more than that. When you choose a competing response, there is no ideal and perfect response, but you can choose 1 or 2 responses that will cover 90% of the situations where you pick. This is a good start. It's a rule of thumb, but the smallest number of responses that will cover the most situations. And then you start implementing 1 at a time, right? Just as simple as possible, but just not so simple that it doesn't work. When you start implementing a competing response, you start establishing it as a habit. So you don't treat it only as a cure or an antidote for skin picking. You treat it as a new part of your life, as something that you will be doing and using every day. Not forever, but think of it in those terms. So find a context where it will be useful. This is why awareness training is very important. Where are the spaces where you pick? You might want to, if your competing response is an object, then you might want to buy several of them and then keep them in different locations so that you always have them on hand. Or you might want to select a competing response that you carry around with you at all times so that it's always accessible. If it's an action to perform, you might want to still keep something around you that will be a reminder for you to actually perform the action. So how do you select a competing response? You select it based on what your triggers are, where you do it, how intense it is, whether it's focused or automatic. I cannot tell you what your competing response will be. This has to be a part where you're being creative. So usually when I work with clients, I will analyze the data with them together, and then I will tell them just start with something, see what will work based on the conclusions that we reached, and then they will select responses on their own. The reason for this is because, first of all, when you select your own competing response, you are responsible for its success. If you rely on your therapist or anyone else to give you advice, it's much easier to give up because there's less accountability and less responsibility. And third of all, I think no one but you can actually know what will work for you. Right. So these are some of the common responses that I thought of and that I actually saw today. So I made this presentation today, and these are some of the things that my clients were using today. Clenching their fists, so like just doing this, right? Using stress balls, which I had prepared, but I don't know where I left them, but you know what stress balls look like. Using hand grippers, it's those things that you use for exercise. They're quite good, especially if during the awareness training you notice that there's a lot of restless energy in your fingers. Using stress balls or hand grippers or anything that will get your hands and fingers to move is a good idea for a competing response, because not only does it keep your hands busy so that you can't pick, it also helps you get that nervous energy out. So it does two things at the same time. Knitting is one thing that seems to be quite popular these days. So worry stones are very popular. I have like a few here that I can show you. So you can buy worry stones online, and different types of worry stones will have different textures. If you notice during awareness training that the sensory aspect of the experience is important for you, then maybe worry stones or fabrics are something that you may want to consider. A worry stone is rather small, so you can see the size. This is one that I bought, I don't know, somewhere. I've had it for a long time. So it's blue, and it has a kind of rougher sensation when you rub it. And then you have this one, which is, I don't know what the names of these minerals or rocks or whatever they are is, but this one is, for example, very smooth. So it has a very smooth sensation. And then if the sensory aspect doesn't matter for you, just get whichever one. If it matters, then I suggest that you don't order them online, but instead actually go to, like, every new age store sells these things. So that's like one use for new age stores, is you can find competing responses there. Some people, let me see. So you have like normal stones that you can, like pebbles that you can find on the beach. They also have their own texture. So these are some of the things that you need to pay attention to. One of the reasons why I like worry stones as competing responses is because they're very small and they're easy to handle, even in front of other people, and they won't notice anything. For example, wearing rosaries or mala beads. Mala beads are, well, I have like dozens of them since I meditate all the time, and now when I need one, they're not in this room. But mala beads are basically those meditation beads. You can wear them as necklaces or around your hand, for example, and then you can play with them as a competing response. So that's something that works. This is one of my favorite toys in the world. This is a infinity cube. So I ordered this because I always look for different things that clients can use as competing responses, and I found this on somewhere, I don't know, Amazon probably. And so it's basically like a fidget toy. And for whatever reason, I really liked it. So now I have like 3 of them, and I play with them all the time. They can also be a very useful competing response. There are these puppet toys where you actually get to squeeze the toy and something comes out. So there are toys that actually can simulate skin picking. If this is something that you think it might work, then it's a good choice as well. Spinner rings are also quite useful because they can keep your hands busy, and they are basically jewelry. So you can use them in front of other people. No one will notice anything. So basically, if you keep it on your finger, then you have a competing response at all times on you. The only time when you can take it off is, I don't know, if you need to wash your hands or something. And then there's always bubble wrap. But bubble wrap can be very pleasurable for those people who like the sensation of just of the skin popping, like when they pick their skin. But bubble wrap is noisy, and it's not something that you can use everywhere, but it is quite a popular competing response. So you can make your own competing response. I just gave you some that I saw this morning when I was responding to my clients' comments, but there are many more that can be used. If you want a worry stone, for example, go outside and find one. I think it's much better if you want a necklace, buy that polymer clay and make your own. Kind of like with journals, making your own competing response helps you forge a connection to that response, and then makes it more likely that you will use it more often. You make it your own, you customize it. Keep it in your pocket or purchase multiple ones or make multiple ones and keep them around in every space where you pick. If you choose a competing response like clenching your fist, obviously, don't buy anyone's limbs online, but keep reminders, keep post-it notes, for example, next to your work desk or wherever you might need them. Because a good thing about a competing response like this one is that in itself, it serves as a reminder. If you see your infinity cube on the desk next to you, it's very difficult to forget what the infinity cube is for. So you already have an invitation to use it. If you choose a competing response, which is just a hand movement or a hand gesture, in that case, it is a little bit difficult to remember to use them. So you might really need reminders. Another thing that I didn't list, and I didn't see it today, but I remember now, is that people sometimes will use those mudras from yogic practices as competing responses. I don't know enough about this to be able to actually give you good advice, but if this is something that you've used or heard about, that's something to consider. And then oftentimes, if people are spiritual or religious, they might use prayer as a competing response. And I know that this sounds maybe silly to some people, but prayer can really very quickly center a person and ground them and kind of connect them to their values. And that gives them inner strength not to pick in a moment. It's also quite okay for you to combine competing responses. And if we one day choose to talk about acceptance and commitment therapy, we can talk about how you can combine techniques from acceptance and commitment therapy with competing responses so that you can boost the competing response, but also produce a more long-lasting effect. Because as you can see here, because it's a behavioral intervention, we're talking about merely some sort of replacement. Now, you will fail with competing responses. There's just no way around it. Not because you're bad, not because you're incapable of change, although you might think all these things. You will fail because it's a new habit. Picking didn't establish itself successfully overnight. It just seems that way. No habit does. If you have a kid, and if you're trying to teach your kid to brush their teeth, for example, it can be quite a struggle and it can take a long time. And this is really like hell, not even a child, if a dog, you try to train a dog, you know that it takes a while for them to learn like where to poop and how to do all kinds of tricks. So the same goes for humans. We will fail. This is really inevitable. Now, when you fail, what you can do is you can judge yourself and say all kinds of horrible things to yourself, and then you can make things even worse. By all means, that's a possibility. Or you can actually do something to calm yourself down, journal about the failure as much as you possibly can, in the moment preferably, without censoring yourself in any way. And then once you calm down, you can do like a breathing exercise or a grounding or anchoring or something to help you, just kind of just keep your body calm. And then the next day or the day after, come back, reread what you wrote and learn from the failure. Because failures only indicate that a competing response has its limitation. And everything in this world has its limitation. Every form of therapy, every trick that you do, every habit, every way of thinking will be good for something and bad for something else. That's just really very natural. It's kind of like sciences. Like, I don't know, I went to medical school, so I like chemistry a lot. But if you want to explain gravity, you can't use principles of chemistry, you need physics, because physics explains that group of phenomena. So chemistry, theories in chemistry work fantastically well in certain areas, but then in some other areas, they're kind of useless. The same way that physics is really good if you want to explain how, I don't know why moon orbits around the Earth, but if you want to explain skin picking, physics isn't particularly useful. You can use it as a metaphor, but physics itself really doesn't do much to help you stop picking. And the same thing goes for competing responses. They are not almighty, all powerful, and they're not applicable everywhere. This is why I said start with one or two. The idea is to find a small set of responses that will work everywhere. And we always start with one because we're optimistic and also careful. So we don't want to frustrate you, but we want to believe that one is enough. If you find that you fail consistently in a specific area, that might indicate that this area requires another competing response. But the only way for you to know is to keep journaling and keep tracking your data. So this is very important. When you're in therapy and when you have a therapist, whether our program is in writing or it's face-to-face therapy, you talk and then you always have someone who can remind you and say, okay, so this also didn't work last week. Or if you journal then and review your journals weekly, you can also see what didn't work. After a while, those failures will show a pattern. So this is where it's extremely important to think logically. So a failure just means that a technique is not applicable, nothing more. Sometimes that means that you can tweak your existing response, that perhaps you need to go back to stage one and do awareness training a little more. Sometimes it means that you maybe need to work on your willingness. And then there are other times, I didn't put any slides about that because it doesn't strictly refer to habit reversal training, but you know me, I'm the king of tangents and I cannot help myself. But sometimes people choose not to use a competing response. And to me, this is a very important moment because it can indicate resistance to change. Even though there is very little good that we can say about skin picking, the fact that it has become a habit means that it does something for us. And especially when a symptom is present for a very long time, for a number of years, saying goodbye to that symptom can be very difficult because it accumulates functions. Over time, it becomes our resource, our go-to for a lot of things. And I don't see this very much with skin picking, but I see it a lot with hair pulling, for example, that over the years, it will almost be like a staple around which a person forms a part of who they are, a part of their identity starts to revolve around skin picking. So sometimes saying goodbye to a symptom that is a source of a lot of suffering is something that's not very intuitive to most people, but a real challenge to overcome. This is not something that habit reversal can obviously resolve, and this requires going a little bit deeper under the surface, but it is something that you can also keep in mind. And when these things happen, if you just consciously decide not to use, say, I don't know, you have your worry stone in your hand, and then you look at the worry stone and then you put it down and you say, oh, to hell with it, I will pick now. Journal about this. Try to analyze your thought process and specifically pay attention to your feelings, because this is usually where you will find the answer to that. And then stage 3. So competing responses don't work overnight, so they require patience and they require practice. I suggested that you start with one and then evaluate the response after a week. My suggestion for stage 3 is to evaluate competing responses, let's say once a month. Once you establish a set of functional techniques, don't forget to journal. You don't have to journal extensively, but write down what you do well and what you can do better. Don't phrase it as in I failed at this. Just try to phrase it as in this is where I could improve, because we need to be constructive about this. I'm not being falsely optimistic. I can be accused of many things, but optimism is not one of them. But it is a practical way to frame it. Today, I did well, this and this. I could do better in this area. It can be really just like a few sentences, but try to journal every day or at least 3 or 4 times a week. And then every month, do an evaluation. See what worked, what didn't work, and see if there is a specific area where you show vulnerability. For female clients, one thing to consider, and this is something that I've spoken to with people twice just today, is that skin picking can really be connected to your cycle. This is not because skin picking is inherently hormonal. It can be because of 2 things. One, hormones can affect our mood and then consequently our willingness to affect, to to use our competing responses, or hormones can increase our emotional reactivity. And also because hormonal changes and oscillations can change the quality of our skin. So if seeing pimples, for example, is a trigger, then your cycle might actually be a good indicator of those parts of the month when you need to be additionally vigilant or prepared. So this is also something to think about. If this is a regularity that you notice, use it to your advantage. Use it as a way to be proactive. Habits are contextual. So I said to practice competing responses as much as you can. Not everyone likes to do this, in which case I recommend that you just kind of select 10 minutes, like if you pick in your office. The reason why I'm using office as an example is because I'm sitting in mine right now. So if let's say I pick here. So I will take 10 minutes and practice my competing responses here. I prefer it. I think it gives better results if you use them throughout the day, but you can also just reserve some time every day to practice your competing response. Sometimes it can actually help, like if you start your work and you're slightly anxious or nervous and you think this might trigger picking, just taking 10 minutes or so to just continuously do competing responses can actually help you not pick later on. So it also has this additional effect. As I said, journaling as much as possible. And one thing that I didn't put here is that it would be a good idea, if you're doing this without a therapist, to find an accountability partner. This can be someone that you know well. It can be someone you live with, it can be your parent, a good friend. But I think what would be the best is to find someone who struggles with a similar issue and then try to work through the process yourselves and do it together. Because in my experience, I mean, I'm a therapist, so my recommendation is always going to be therapy, because if you have a qualified professional who knows how to deal with this, they will know what to do when you don't and when you feel desperate. They will likely have things under control and a different perspective. But I think connecting with people who struggle with skin picking can be an experience that has a lot of value on its own, because there is a kind of understanding that I think only people who struggle with it have it. So an accountability partner can be someone who provides support for you, someone that you text with every day, someone that you meet up with on Zoom, for example, or Skype or whatever, once a week. And then together you can discuss what you did well and where you can see space for improvement. This is one way to do it. If you don't know where to find people, we have a forum where you can look for stuff. And we recently opened a Facebook group, which I think might be a better place to go, because the Facebook group is closed. I mean, anyone can join. It's just that you have to request access and it's moderated. So it's kind of a safer space than the forum, which is completely public. So you can ask there if there's someone that wants to give it a try, and then you can work through all this together. Now, when you do evaluations, these are some of the things that you can pay attention to. Obviously, where did the response work well? We need to establish what it's, as Kelly would say, range of convenience is. So where is it applicable? Second, where it doesn't work, where it isn't applicable, because you couldn't perform it well or because it wasn't efficient enough. And it's important to note the difference, because if you couldn't perform it well, then maybe there's something that you can change about how you use it. And if it's not efficient enough, then obviously it needs to go and needs to be changed. Even if our competing responses are lovely and beautiful, we should not be attached to them. They're just tools. Were there any situations where you forgot to use them? This is important because it can indicate resistance to change. We humans tend to conveniently forget instead of actively resisting. And it can also just mean that you need to put reminders in those places. Like if you need a competing response in front of the mirror, just put a post-it note. or put something that will remind you of a competing response. For example, I have a client who has this little Buddha statue, and then she keeps it next to her mirror because she shares an apartment with people and she doesn't want to write on the mirror, remember not to pick your skin when you're in front of the mirror. But for her, the Buddha statue reminds her of being calm, and it's just like a Buddha statue. They're so common that they barely have spiritual significance anymore. So that's something that you can use, and then she knows it's a reminder, but other people who live with her have no idea what it represents. They just know its place is in the bathroom. So that's one way to deal with this issue. And then, of course, as I mentioned, if there were any situations where you consciously chose not to use your competing response. This is something that strictly is outside of the range of habit reversal training. And this is something where you might need to either look for a support group or talk to your accountability partner or just talk to someone you're close with or your therapist, because it usually requires a little more than just technical adjustments. And of course, the emotions that you identified and the triggers that you identified can all serve as starting points for much deeper work. Habit reversal training will help you gain control over your picking, and it will help your skin recover, and it will help you reduce the damage that you do or completely eliminate the damage, depending on how successful you are. But what triggers you is always psychological. Triggers trigger us because of what they mean to us, not because of anything else. So there is always deeper work to be done. With all the information that you collect, especially from awareness training, you really have a great starting point to understand your own psyche, to understand what these things mean to you. And this is where you can start doing a deeper dive. This, again, from my perspective, because I'm a therapist, requires psychotherapy. But you might have other ways in which you can do that. There are millions of ways. There's meditation, there's journaling, there's combining the two. There are hundreds of different practices, workshops, self-guided programs that will teach you about your body and how to work with body excitations. There are many, many different ways that you can work on self-development. So in that sense, I really, really encourage you to use the information that you gather and everything that you learn, and then dive in deeper. Because with habit reversal training, you will deal with the habitual aspect of it, but you will not deal with the underlying causes. Behavioral therapy simply doesn't address those. In fact, I would say that behavioral therapy has a kind of reductionist view of human beings that I don't share. So it only thinks of behaviors. It thinks in terms of, stimulus and response. And in my opinion, there's a lot more to human beings than that. And a deeper dive is really worth the effort. So don't stop at habit reversal. By all means, do it because it is useful. It works. It will help you. But it happened in the past, and it happened more than once, that I've had clients who say, all I want to do is habit reversal training. We do the habit reversal training. They find their techniques, reduce picking. And then a couple of months later, I receive an email and they say, oh, well, I have panic attacks now. Can we work on stopping the panic attacks? And then most of them are smart enough to recognize that one symptom disappeared, but another one showed up. But sometimes people will come and then they will say, look, I really don't want to dive in beneath the surface. Just give me some ways to deal with the panic attacks. So in my opinion, a deep dive it's painful. It takes a long time, but it's always worth the effort. In our program, this is where, once we finish habit reversal training, this is where we start implementing acceptance and commitment therapy. And even though I think you can go even deeper than acceptance and commitment therapy, far, far deeper, I think acceptance and commitment therapy gives you a very nice framework, even a framework that you yourself can apply, because its principles are not that complicated. They just require effort like everything else in life. But it will give you a different way of relating to your experience, for example, and it will give you a different understanding of your thoughts and your emotions, which in itself can be of great help. So even if you don't go to any kind of therapy that will get you to understand why is it that you feel something, it will teach you how to relate differently to what you do feel. So that's already a step up. or a step down if you think of it in terms of depth. So please don't implement habit reversal, but don't stop there. I will give you some general ideas in terms of where you can go about looking for causes and what long-term solutions could look like. But because fundamentally my thinking is, I mean, I use cognitive therapy in my work every day because SkinPick is a program that's based on CBT. But my general worldview is constructivists, and constructivists tend to think in very individualistic terms. Constructivists like to think about each person's specific experiences. We can have the same problem, but very, very different causes, because the evolution of the problem can be completely different, because we all have different experiences. We've had clients from over 20 countries. Those are clients from vastly different cultural backgrounds. Skin can mean one thing in the United States, but a completely different thing in Europe, and something entirely different in India, for example. Right? So even on that level of culture, you have different solutions for different people. Not to mention our families and this kind of microcosmos that we grew up in. So there are no universal solutions, but there are a few points that you can remember. One, it's really not just a habit. So this will deal with the habitual thing, but not with what actually caused the habit to be established. Very often, skin picking is about stress, anxiety, and other difficult and intense emotional experiences. This means that first of all, you need to precisely identify which ones they are, and then learn how to deal with them. When we talk about dealing with difficult emotions, there are always at least 3 layers of it. One is learning to be with those emotions without reacting to them, where you have techniques like RAIN, grounding, mindfulness, diffusion, all kinds of stuff. Second is to actually understand and identify emotions. And then third is to extract information from these emotions so that you can grow and develop as a person. So this is quite a lot of work that needs to be done. Dealing with these issues is really your path forward and a long-term solution. And then, as I mentioned, finding an accountability partner, whether someone who struggles with a similar issue, someone you trust, or a therapist, it doesn't matter. As long as it's, my God, I don't think I spelled a single word correctly on this slide. I might have to revise my New Year's resolution in November. I'm really sorry about this, but this is where my obsessiveness comes into play. Anyway, so finding someone to work with is really important, because dealing with this all alone is really very hard. And I think sharing it with other people is useful in several ways, one of which is that it removes a lot of shame and a lot of stigma. Shame is a mechanism that really reinforces symptoms. And this is, I think, kind of across the board. And I think it extends even more than just mental health. It extends into our social life. I often use this example with my clients, is how in the 90s, when political correctness became popular, we kind of started shaming people for using certain words or saying certain things or doing certain things. And then obviously they stopped doing them in public because no one wants to be shamed, right? So shaming really stops the behavior in public. But it doesn't really change anyone's minds. People still think what they thought before, they just don't say it out loud. And in a way, when they don't say things out loud, their beliefs become even more permanent. They become stronger because they're never actually examined in any way. And I think and then you have a situation like the last couple of years where so much racism, for example, that was shamed away from public discourse, just bleeds in all of a sudden. And people I remember only 6 or 7 years ago when people were talking about living in a post-racial society, and then now look where we are. This is because shame never changes anything. It just seemingly cleans up our public space, but internally people are still the same. And the same exact thing goes on with mental health. We can hide it. But by hiding it, we're just reinforcing the behavior. Having a support group, sharing your experiences, talking to them about people about them will help you get some of that stigma and some of that shame away. So once they become shared experiences, they become much easier to deal with. And also, 2 or 3 or 4 or 5 heads will come up with a better strategy than just one head. That's also kind of a thing. So try to find a group of people that you can share this with. As I said, like a free resource is our Facebook group that you can go and then just share experiences with. You can also find support groups. There aren't many, and we might form one ourselves. So there might be one available, but you will be notified if this happens. And then, yeah, in the end, I wanted to share a resource that we've had for some time, but I never mention it. I don't know why exactly, but I am mentioning it now. We created a free version of habit reversal training for those people who cannot afford the program. And so you can go to our website. There's a link called Tools in the menu, and then just choose the self-help program. You can sign up for it, and you will receive a document in a PDF format and a video. Sadly, it is me. I'm so sorry for you. So you will have to look at me for a couple of minutes. That will help you explain how to organize habit reversal training. And the forms will give you some questions, and they will guide you week by week. So you will basically get like a free workbook that you can use. And then if you find an accountability partner, this is even better. And then you can go through the workbook and use it yourselves. So this is a completely free thing that you can use and that we offer. And for some reason, I always forget to mention it, but since this is the topic today, then here I am mentioning it.